Okay, Greg, AJ, we have started streaming, so whenever you guys are ready, we can go ahead.
Hi, uh, welcome to our webinar today to discuss some changes to the HCBS settings rule that went live this past Friday. And we're here to give you some an overview of what that means for folks who are receiving home and community-based services and what you can do to make sure that everything is going smoothly there. So my name is Greg Robinson. I am the Deputy Director of Public Policy for the Autistic Self-Advocacy Network. I will pass it to AJ to introduce himself, and then we'll get started.
Hello, everyone. My name is AJ Link. I am a policy analyst at the Autistic Self-Advocacy Network.
Okay, so we can dive right into it. Let's start with an overview of what home and community-based services are and what they mean for us as disabled folks. So first, let's back up a bit. Long-term services and supports are a range of supports that help people with disabilities live our everyday lives. So they can include things like support workers to help us do activities that we do every day, including dressing, washing up, cooking, eating, shopping, getting to doctor's visits. They can include things like help with transportation, which can be paratransit, it can be assistance taking transportation, and it can be some types of on-the-job supports as well, such as job coaches, assistance in job searching, things like that nature as well. Home and community-based services are when we get those long-term services and supports in the community, typically through providers in community-based housing. That can be our own homes, or it can be homes that are smaller, where we may live with other people. But in either case, we are in the community, we are part of the community, and we're able to sort of interact with the folks around us. So now we can talk about what the settings rule means as part of that. So we'll turn to AJ to talk about what the settings rule is and what it does.
Hi, y'all. This is AJ. What is the HCBS settings rule? It's a rule that the government made. It's administered by the Center for Medicare and Medicaid Services, or CMS, and it regulates what settings must do in order to receive Medicaid dollars. What does the HCBS settings rule do? It says what your rights are when you receive home and community-based services. It says what places you can receive HCB services in. Those would be the different kinds of settings. It says what places you can't receive HCBS in. So the settings who do not meet the settings rule or do not abide by the settings rule cannot offer HCBS with Medicaid dollars. And it gives states information on how to see if HCBS providers are ready to follow the rule and are in compliance.
So let's talk about the rights that the settings rule gives us. So the settings rule does lay out a number of rights that you have to a number of rights that you have in terms of what you should be receiving as defined as being part of the community. So this includes a right to live in the community, a right to choose where you live, and a right to choose where you get services, in any place that you receive HCBS. So that is whether you receive home and community-based services in your home or in a setting that's run by a provider. There are some additional rules. you have a right to a person-centered plan, which is a plan that you participate in the writing of. It should focus on what services you get and who will help you get them. And it really should be individualized to you, and what your needs are and how you want to receive services. So this is something that people should be meeting with you and talking about how your needs can be met in a way that you have input in and you are really helping to drive. And you should also have the right to have freedom and make choices about your life, both big and small, from whether to go out in the community, to whether you want to get a snack in the middle of the night, to how you decorate, to whether you want to decorate your room. And so some of those are all rights that you have. Continuing on, you also have a right to respect and privacy from the people who give you HCBS. That includes a right to privacy in your room. It also means that you should be respected by your providers. They should treat you in a respectful manner. And part of that is also being a right to be free from restraint and seclusion, which can often be which are things that can be done, that are sometimes done to disabled people historically, but you do have a right not to have that be done to you. So in addition, those are rights that you have everywhere, whether you're whether you're living in a home of your own, or whether you are living in a place that a provider owns, like a group home. There are some more specific rules about what you should be receiving if you live in a place that is owned by a service provider. So an example of a place like that is if you are in a group home where if you are in a group home where you receive HCBS, then you should also get a number of other things according to the rule. That includes a right to tenant protections and a lease or a similar document. So what this means is a lease. So a lease is a legal document that lays out what the terms are for you living in the place that you live. Usually it has a list of rights that you have, responsibilities you have as a tenant. Responsibility is the person who owns the place that you live has to abide by as well. And what the rule says is that you should get, even if you don't rent a home, you should have a document that is like a lease that says what your rights are and says what your responsibilities are and says what the responsibilities of the person who controls that place is. And that should be the same as any other document that anybody in the community you live in would get for renting a place. So it should have the same, it should respect the same sort of tenant protections that you would have if you rented in your community. Other rights that you have under the rule, if your provider owns the place that you live, include additional privacy rights. This includes the right to lock your door, the right to pick a roommate if you have one, and the right to decorate your living space however you want. You also have a right to an accessible place. Your home should be accessible to you. You have a right to control your daily life and schedule. That includes choosing what you want to do during your day. It also means if there is a potential group activity, you have the right to choose to do it or not. You have the right to have visitors anytime, including visitors if you want a visitor to stay overnight. And you have the right to have food whenever you want. So that means if there is a shared refrigerator, you can have access to it whenever you want, any time of day. So those are some of the rights that are provided as part of the rule to people who are in settings that are controlled by the provider, as well as the general rules that apply to anybody in whatever setting they're receiving HCBS in. So now to turn back to AJ, we can talk about why we need this settings rule and what it does for us.
Hey y'all, this is AJ. We're going to talk about why we need the HCBS settings rule. The HCBS settings rule makes sure we have basic rights when we receive services. The settings rule has taken over 9 years. And so it's important to realize that people now have rights when they didn't have them before. A lot of people weren't getting their basic rights. People had to follow a set schedule. They didn't get to decide their own schedule, what they got to do when they did it. People didn't get to eat what they wanted or when they wanted. They were often told what they had to eat and when they had to eat. People were restrained and secluded a lot more than what's allowed under the settings rule. And people didn't have as much say over their own lives, which the settings rule helps with self-determination. So before the HCBS settings rule, which Greg told you went into place last week, a lot of people were getting, quote, HCBS, but in name only. So they weren't having their rights respected under the home and community-based services laws. Because our HCBS providers controlled their lives, it was like they were living in an institution. And as Greg said, home and community-based services are not in institutions, they're in community, and they're providing the long-term services that folks need.
So that's sort of an overview of the HCBS settings rule. Now, last Friday was the start of the implementation of the rule. So it is in effect now, but that doesn't mean that all of the rights that we went over are things that we all get right away, unfortunately. So one thing we're going to talk about today is why that is and what we can do to make sure that we do get those rights. So the reason some of our rights are taking longer is because of the COVID-19 pandemic. COVID-19 has had a pretty serious impact across the country. It has made a lot of people sick and a lot of people unable to work. And that has meant that HCBS providers have really had a problem finding enough people to work for them. And this was already a problem before COVID-19, but COVID-19 made it much worse. And a lot of these rules, a lot of these rights that we have that are very important are things that we do need more support workers to make sure that we can get those rights in a way that really does support us. So some of the examples of that are, if there's, as an example, if you are in a setting, a group home, and there's a community activity that you don't want to be part of, you should have the right to stay home, but you should still have a support for that. And that does mean there need to be more support workers to support that. And given the pandemic, it has been harder to find workers to make sure everyone can get those rights. So what CMS has done, what the federal government has done, is that it has given states more time to meet the rule and to make sure that they are giving us these rights. So this does apply to some of those rights, but not to all of them. And the rights that are impacted are rights that do require more support workers. So those are the rights to Those include living in the community with people without disabilities. So some of the rights around where you can choose to live, including having a living living place to yourself, whether that's an apartment, room, or private home. Your ability to choose a roommate, and your ability to live in a setting that is not disability specific. So states are being given more time on this, but there are also rules that the state has to follow to make sure they are still moving towards giving us these rights. So what the states have to do is they have to submit a corrective action plan to the government, to CMS. And a corrective action plan is a plan that tells the government when the state will be able to give the rights that we talked about. And they have to give a timeline that they're going to follow to get there. The general range of time, the government has said that they don't expect states to take more than 5 years, and most states that we've seen have said they don't need longer than 1 to 2 years to give people these rights. So that is what we should expect, is within a year or two we should have we should be through the corrective action plans according to what states have said. So now turning to AJ, what can we do if someone isn't respecting our rights, and if we're not getting what we're supposed to be getting?
So we'll talk about what to do if an HCBS provider or worker is not respecting the rights of someone receiving HCBS. If a provider isn't respecting your rights, you have a few options. You can talk to the provider and tell them why they need to respect your rights. You can talk to your case manager and ask them to talk to your provider for you if you don't want to talk directly to your provider. If your provider isn't respecting your rights, you also have a few other options. You can talk to your state's protection and advocacy organization, or PNA. PNAs are legal groups that help people with disabilities in different states. Your PNA can help you tell your state government that your rights aren't being followed. I will note that sometimes the PNAs aren't as helpful or cannot help for various reasons and circumstances. There are other people and groups that you can talk to, but these are the main ones. You can find out more in our resource, Who Can I Talk To If Someone Isn't Respecting My Rights, on our website. Greg?
All right. So on that note, we do have a number of new resources about the settings rule and your rights under the settings rule, and who you can talk to get support if you are not receiving what you're supposed to. So we have ASN has a toolkit called This Rules, which talks about the settings rule. We also have guides about the settings rule and guides about improving HCBS in general. The Council for Quality and Leadership is another organization that has videos about the HCBS settings rule. CQL is a group that works to make sure people with disability live good lives. The Bog Center out of Rutgers has 2 toolkits on the settings rule, one for folks with disabilities and one for our supporters. And they also do work to make sure people with disabilities live good lives. Now, in addition, we do have a number of new resources on the settings rule that talk about how you can find out what your rights are under the HCBS rule, including where you can go to find information about particular to your state, about what your state is doing. We also have resources on more detailed resources on who you can talk to if someone isn't respecting your rights. We go over the complaints process, as well as if you are self-directing your care, how you can fire a worker who is not respecting you. We also do mention a number of other organizations, councils of independent centers for independent living, DD councils. There are a couple of other organizations, statewide organizations that can help you. Every state's a little different in terms of who's the most helpful. But if PNAs aren't available to help you, if depending on how your state is organized, then some of those other organizations can as well. And we include that information in our toolkits as well. And then we also have a resource that will give you information on what specific rights you have under the rule, based on the type of setting you're in. So we sort of cover both if you're living independently in the community, if you are in a provider controlled setting, if your provider control setting looks a little more restrictive and might not be community based, what that looks like, as well as some information on what rights you should be expecting in each of those places. So so I encourage you to I see that Nora shared the link to that. I strongly encourage everyone to check out those resources, and I believe we have a bit of time for questions now. So thank you for our presentation.
Great. So one of the first questions we have in the chat is from Carol, who asked, rules and rights are important, but only effective to the extent they can be enforced. What resources, real resources that are actually available, are available to support people whose rights have been violated?
So, as you're saying, I do think this is really important. This is a really important part of where we are now, and what we need to be doing now is making sure that if people's rights are being violated, that they are able to both use a complaints process to make those concerns known, that they have people fighting for their rights. What we generally suggest is that the PNA should be the first stop, but we do recognize that PNAs are not always resourced to support every complaint that comes through. And I think that is a concern that we have. I think every state should, under the rule, have a complaint, a place to process complaints that they're receiving from people receiving services. One thing that is very important for people who are supporting people who are receiving services is to help them through that process. Because I think one thing that we are very concerned about is making sure that complaints contact is clear, transparent, accessible to people who need it. And I think we have some concerns about how each states are doing it. So if people can support people in making those complaints, that can be really critical. We also think your provider should also have a grievance process that you can follow, but as well as your state's DD agencies. So there are a number of organizations. We do encourage people to check our resources on how to file a complaint, but this is a place where we do expect that we are going to have to really fight and make some noise to make sure that the rule is being followed. So we really want to encourage people to use our resources, but also to know what is going on in their state and to make sure that they are filing complaints if their rights aren't being respected. So
this is AJ. Greg, I don't know if you also said that CMS does have a complaint process on their website. It's difficult to find and navigate, so you may need help navigating that, but hopefully they will make that process more transparent and accessible as we move forward.
Also in the chat, Carol said, also wonder what's being done to attract workers, incentives, living wage pay, time off, etc.
Yeah, this is another thing that we are, as advocates, this is something that we're really pushing on in the policy space. We do, yeah, I think pay is a really significant factor here. We do know that direct support workers are not generally well paid, and that contributes to both the care shortage, but also people don't stay in the job very long, and that sort of that churn also makes it harder for people to get the supports they need. So um, we have seen efforts to improve pay conditions. We have also seen some efforts even to get to get more data on who is providing the support and what the state of support workers is as an industry. There's, I believe, currently a bill that wants to establish a new occupational category so that we can even define what a support worker is and what that work looks like from just a statistical, from a data perspective. So this is a place where there is a lot that we are hoping can be done, but it is something that honestly, especially to improve wages, that is going to take money and that's going to take investment. So that's something that we're trying to work towards. A lot of funding, a lot of work towards better funding for HCBS is also about ensuring that workers are adequately funded. So I think that's what I could say there, AJ, if you have anything to add.
No, I don't think I have anything else to add. I would say that there are lots of different states and the federal government who are working to alleviate that, and they're trying to find creative solutions, but it is a huge problem.
Natalie asked, where do people find these support jobs? Are they listed somewhere?
This
So,
is go
AJ, go ahead. Go ahead, AJ. Yeah.
Yeah. So support care workers they have different titles based on who the provider is, who the state is, what type of care they're providing. So there are ways to get these jobs, but it's not under one specific name or title. And you kind of have to just search for care worker openings.
A lot of support workers do work through agencies that provide direct support care. So that is, I think, another piece of that. So there are, yeah, I think that's what I can add to that.
LaBrenda asked, what is being done to increase critical and emergency support for individuals being served?
I ask for clarification on that. I think what I can say is that I know that so I know that there have been efforts during the public health emergency to ensure that there is both greater to sort of increase funding for providing HCBS services. I think one thing that we have hoped has been able to support states that are making the transition to providing more HCBS has been some of those flexibilities. In terms of, if you mean, yes, okay, thank you. Individuals with dual diagnosis and challenges securing housing and medical placement when necessary. So I can speak to a couple of things there. There are some services provided through HCBS called behavior support services that can include some crisis, some behavioral health crisis supports. That is often one of the more common things that those provisions of waivers are used for, but it's also not usually, there's a lot of variation between what states provide, and it is not often not as much funding as there is need. So I think that's one thing that we are actually currently working on another project to look at more closely in terms of what supports we can give people who have behavioral health needs and have dual diagnosis. So their states vary a lot, is what I can say. Waivers vary a lot as well. So we are hoping that we can provide more concrete answers to that soon, because we are hoping to produce a very detailed toolkit on this. As far as the other piece on securing housing, some waivers do provide some support for housing transitions, and I believe MFP can also provide some housing transition for people exiting institutions. I know some supports that people need around housing, including housing search and fees, can also be a place where some waivers can provide some support. But this is another issue where I think there are a couple of different pieces that are sort of, I think, to be frank, none of them are really have the funding that they need to provide the supports they need. But I think HUD Section 811 PRA funding also exists to provide support for people with disabilities who are connected to supports and need some support in seeking housing. But I will also say that many of those really do need more attention and support and focus in order to really make them work for people, to make sure that they're getting to the people who need them. And I think this is a place where, again, we're doing active work, because this is a place of pretty significant concern.
Perry asked, how will this rule affect people waiting for HCBS? Will anything change, or is it just people already receiving HCBS?
So this rule, it doesn't directly impact people who are currently waiting. I think there is a recognition that one really critical piece of providing of making sure that HCBS is available to people is making sure that wait lists are being cleared and that people are receiving the supports that they need. And so one thing that we are pushing for on a national level is more funding to states to make sure that they can actually provide HCBS to everybody who is waiting for it for services, and that they are able to clear those wait lists. So I believe someone else in the chat mentioned a bill that the HCBS Access Act, which is something that we support and have continued to support it, which will make HCBS a mandatory program, which means that it should be funded equally for people who are getting supports in the community. So that's one approach that can ensure that we actually do get the funding to make sure people are able to get off wait lists. But I think that is really the other piece of this, is making sure that everyone who is waiting for HCBS now is able to get it. So
This is AJ. I would add that the settings rule is about the settings where people are receiving HCBS services. That's redundant. Not those who haven't received them yet. Those who are waiting will still have the same protections once they start receiving HCBS.
So I will read out Angela's comment because I think it is important as well. The National Council on Disability, which is at www.ncd.gov, has a report called Strengthening the HCBS Ecosystem on their website. They are an advisory council to the federal government and the president. Their report addresses a lot of the things mentioned in this webinar today. And I believe, among other things, they do talk about a lot of the issues around the workforce and about the funding situation in the wait list. So for a lot of for folks' questions there, I think it can also be a very helpful resource.
Amber says, I'm very concerned about several state agencies' lack of willingness to hold settings/providers accountable for coming into and remaining in compliance with the rule. Does ASAN have any concerns about this and how advocates in states can help push state agencies to ensure compliance with the rule? Sorry, don't mean to be a downer. Sorry. This rule has so much potential, but only if states are meaningfully committed to ensuring ongoing compliance. Thank you.
No, I appreciate the question, Amber. I think this is a really important point, and I think it's one thing that we're trying to emphasize is that last Friday was the start, not the end of our fight here. And we are going to need to fight to make sure that states are actually meeting what they're required to under the rule, that they and that we're also going to have to push CMS to hold states accountable if they don't. So I think it is very important that if people see examples where people aren't getting what they're supposed to, where people's rights aren't being respected, and where states aren't meeting their commitments to get in alignment with the rule, that we use what's available to make those complaints and to make sure that those complaints are reaching CMS as well as the state. So I think this is a really important part of what we have to do going forward. And it really is going to be a place where we have to make sure that we're heard and make sure that we are making noise when we see things not working the way this rule is supposed to. Because this rule, I agree, Amber, this rule has the potential to really change the lives of disabled folks and our ability to be part of the community in a really profound way, and how we receive services and whether they reflect what we want and what we need, but only if they're followed. And we're going to have to really push people to to follow these rules. So this is where our work ahead of us lies. So I really agree with that. And I think while we're saying that going to the PNAs is an important part of that, I think there are a lot of it. The main thing is just making sure that whatever process we have, that it is really continuing to push. So I think we talk about a number of possible options, and it really is going to vary by state, but the most important thing is to make sure that these things do reach CMS's ears. So
Samantha asked, is there a due date for when caps are received?
So this is a little complicated. I think the deadline for caps starting as of implementation date was back in December. I think this is CMS using a process that they have for states that are out of compliance already, and sort of applying it forward for states that knew that they weren't going to be ready. So it does mean that states, if they're not in compliance, can always be put under a cap. Those are going to look a little different than the ones that states are starting with now, though. So it isn't so much that there's a due date for new caps, because those are always the ordinary process, one tool that CMS has when states are not in compliance. But it's more that the caps that some states started with are kind of a slightly different case, because that does push back some of the things we're expecting. So I hope that answers your question. It's those caps that are already in place. They were submitted. Those requests were submitted back in December, but there are opportunities for states, if they're not complying, to have CMS put them under a new corrective action plan to address those issues. So again, that's something, if we see issues and we raise those issues, that is something that may come out of that, and it will look a bit different than the ones that they're under now, because there are, honestly, they should look different because there are different reasons for them.
Taylor asked, do you have resources for better supporting those who are non-speaking and whose rights, wants, and needs are not respected because of that? For instance, my brother is just learning how to use AAC, and it would be hard for him to communicate his preferences.
I believe we do, but I will also open it to the rest of the team here, because I think they may know those resources a little better than I do.
I think this is AJ. I think we have AAC resources and resources about the importance of access to effective communication, in terms of specific resources on how folks who use different methods of communication to advocate for their settings rule rights. I don't think we have that resource. That actually may be a good one to provide, but I think it's really important to allow folks to have the autonomy to communicate for themselves when they can. And part of our job is being able to educate folks in an accessible way so that they know their rights. So that is some of our resources, like know your rights and this rule rules, and being able to put things in accessible language, whether that's plain language or easy read, so that people know what rights they have and they can communicate for themselves.
This is Dean. I'm also sharing some resources that are not ours, but may be helpful, specifically about supported decision making and AAC users, including folks who are just learning or haven't started using AAC yet. But generally, I would also suggest looking into our resources on supported decision making. That seems like it may be relevant to the conversation. Lori also said, to dovetail off of Taylor Davis's question, do you know if there is a conversation on the national level to support trauma-informed training nationwide? and then said, here is the Oregon website in case someone doesn't know what it means to be trauma informed.
So I know that that's something that we have also seen and discussed in the context of what it means to provide behavior supports and what it means to provide and what it means to provide dignity and respect to people receiving services. I think this is an important component of that and something that we do want to emphasize because I think we don't like to, we don't want to say that everybody is necessarily traumatized, but a lot of people experience trauma through traumatizing experiences through a number of sources when they receive services. And I think it is really important that service provision be trauma informed. So I think I think that is something that is a critical part of this conversation. I think we also do want to make sure that we are I thank you for sharing the Oregon website because I do think that's a really helpful resource, and it is again something that we're talking about in terms of quite a bit in terms of what dignity and respect look like and what meaningful and effective behavior supports for people who do need behavior supports look like. So.
Carol asked if someone would be able to elaborate on Judith's comment. Judith said, I'm disturbed by the constant and relentless effort for all services to meet medical necessity when the whole point of Medicaid waiver was to waive medically necessary criteria in order for Medicaid to provide HCBS services. The Olmstead Act, which drives this funding, does not mandate these funds go through Medicaid. This is how they're cutting so many services.
So I think we can back up a bit and talk about Olmstead and the institutional bias, I think, a bit here. So the Olmstead decision did say that people have a right to receive services in the community if they are able to get services that meet their needs in the community. And that Supreme Court decision did not change the law around Medicaid, unfortunately. And the Medicaid law says that LTSS provided through I also want to apologize if I did not explain this thoroughly or clearly enough at the introduction. I realized that I kind of sped through it. But Medicaid law says that LTSS services provided in institutional settings have to be covered by Medicaid. But home and community-based services, there is no such law. And the waivers that provide HCBS are waiving the requirement that services be provided through institutions. So that is the waiver of the mandatory funding that creates the HCBS waiver. Now that is a waiver of one of the things that it waives is the requirement that it be cheaper to provide HCBS than in an institution. So that is one place where if medical necessity determinations are then being used to restrict services, that kind of undermines that conceit of the waiver, as I understand Judith's question. Now, Judith asks why we're not advocating change that, and that is one thing that the HCBS Access Act does, which is a piece of legislation I believe has been introduced this Congress that we would like to see pass. The main thing that does is it does turn HCBS into a mandatory service that Medicaid has to provide, and that does change what that does essentially eliminate the institutional bias. So that is one thing that we are advocating on, and one thing that we are hoping will pass, because that is the next thing that would really hugely change the lives of disabled people, especially those who are waiting for services now, or who are trying to exit institutions. So again, thank you, Judith. I think those are really good points, and that is something that we're definitely fighting for, and we really encourage people to join the fight on, because I think that is really the next thing that we really need to achieve.
This may be more for the chat generally, but I wanted to read from Jamie said, anyone in North Carolina know a funding source for HCBS to provide PCA when their income isn't enough to pay out of pocket, but they have too many assets to get Medicaid?
I will open that to the chat if anybody is aware of anything. I would also say one challenge I think that we've seen is that HCBS is the dominant way. Medicaid is the dominant source of HCBS funding. It is most people who are not receiving HCBS through Medicaid are self-pay, and that is not really sustainable or for people with disabilities. So I think this is another huge challenge, and we are really looking at advocacy opportunities around that. But if anybody does have more detailed knowledge specific to North Carolina, I will really open the chat to chime in there.
Carol asked, sorry if I'm slower on this one, but going back, does medical necessity mean requires nursing home level care? To qualify for HCBS.
So I believe this is something that will vary waiver by waiver. Usually, HCBS waivers have criteria around activities of daily living, and sometimes IADLs, but it is very specific to the waiver, the population that the waiver is serving. But I do also know that, again, this is partly a product of it being, I mean, through Medicaid, which is always very state by state and service by service. But the fact that HCBS is an optional service also means that each waiver is a little different in who it serves and how. My understanding is that some services are maybe limited by medical necessity determinations, though, as Judith was saying. I couldn't speak with more specificity there, though, unfortunately.
Jamie asked, are there plans to get Medicare to cover these services?
I see that it looks like Amber in chat has answered that that some Medicare Advantage supplement plans are covering these services. So that is actually useful information for me. I thank you for chiming in chat. I would definitely also be happy to review those. But I think that is more information than I had. So this is new as of 2019. So yeah, no, thank you for that information, Amber. That is very helpful. And Samantha also said that if an individual has received services, that person may be eligible to continue eligibility through 1619B, which is continued Medicaid eligibility. So those are for dual eligible folks, they may still be able to get services that way as well. To add to that response. So
Carol said, last question from me. Which agency or whom would be best qualified for information about this in Massachusetts?
So I think you said that I just want to refer back. I think, did you say previously that you had tried the PNA before and ran into issues? Advise eligibility services and programs. So I will confess that my specific knowledge about individual states is a little limited, but if anyone in chat can add, I can also I'm also gonna what I would also like to do, Carol, is I will share my email with you. And if you can follow up with me, I can try to get you that information, if that would be helpful. All right, yeah, I think.
All right, everybody, I think we're going to go ahead and wrap up for today. Thank you so much for these questions and this amazing discussion. Obviously, we're going to keep working on this, keep advocating for all of these things and more, and to hold this to the incredible change that it can be. If you have further questions, you can send them to info@autisticadvocacy.org. We'll drop that in the chat. And please do check out our resources, and hopefully some action alerts coming soon. Thanks so much again, and have a great rest of your day.